and welcome to another episode of HOC TV. We are so excited because today we have Dr. Misunaru and we are featuring her for Doctor of the Month. Thank you so much for being here with us.
Thank you for having me.
Yes, of course. And so we're going to ask her a couple questions. We want to find out about you, how you got started, about y'all's practice, what patients can expect, so on and so forth. So tell us a little bit about yourself.
Well, I am a general surgeon. I've been in Midland for a little over 2.5 years. I do general surgery, so I do everything, but then I specialize in breast cancer and breast surgery, so about half my practice is that. The other half is just doing anything at gallbladders, appendicitis, that kind of colon operations, hernias, that sort of stuff.
Okay, that's really cool. I like that you're specializing in breast surgery. Okay, so tell us a little bit about that. Do you have a lot of women that are coming in with these kind of issues?
I am, and most of the problems are usually breast cancer.
Yeah.
And then there are some people that just have benign breast problems, so that could be nipple discharge or a benign mass that may be growing, or maybe they just have a mass that needs to be biopsied to figure out what it is.
Okay, great. This is great. So, if someone is wanting to come in and see you, what would be reasons for them to come and see you, depending on your specialty?
So, as far as the breast stuff, it's usually if there's a breast mass, they have nipple discharge, they've been diagnosed with a breast cancer. And then with the other stuff, it's usually if they have some type of abdominal pain or hernia, something.
Okay, great.
So I am part of Midland Surgical Associates, so that's there's 7 general surgeons, including me, and we take care of everything that's involved with general surgery, including vascular surgery. I have some partners that just do vascular surgery, and then I have some partners that also are involved with bariatric surgery, and then we also do trauma. So we do kind of everything with general surgery.
And so this group that got together did y'all meet?
So what happened is it started by Dr. Shelton Biney, who's been in Midland for about over 30 years, and then he got Dr. Crockett to be involved, and then slowly we've been adding another person, every couple of years or so.
Great, yes.
So we do some interventional vascular procedures here in our office. We also do placement of portacasts here in our office as well, so that patients that need the port, usually it's for chemotherapy, they can get that done in our office and they don't have to go to the hospital to have it done.
Really? Oh, that's huge, because I know some people, they kind of want to come out of the hospital. They want to be able to, kind of come in and do that procedure and go home.
And that's kind of what we try to do to make it very easy, so they don't have to go in the hospital, parking, going through getting lost in the hospital.
Sure.
I understand that.
Great. So when patients come in, what can they expect from you and your staff?
So it depends. If you're coming for a pre-operative visit before you've had surgery, then usually what we do is we'll examine you, we'll talk to you, we'll find out what's going on, see if we can help you, see if surgery is necessary or not. And if, let's say that you've had surgery, then we always follow up with you afterwards to make sure that you're doing okay, that you're, wherever your incisions are, that they're healing well. If you need wound care, and then we just kind of follow up on it while you're getting the home health at home, but we also follow up in between and just to make sure that things are going well, you're healing well. And then sometimes we'll see you after surgery too, once everything's healed up, just to make sure everything is good.
Wow, that's huge, because I think people are looking to be able to go to a practice or clinic and get that kind of care that they want, and knowing that the doctors care about them, they're checking on them, so that's wonderful.
Right, and we won't release you from our office unless we know that everything's healed up, you're doing better, that whatever problem you had is fixed, or we took care of it.
Great, wonderful. So, tell us about your website and contact information if we're needing to come in or contact you.
Well, we do have a website, and it's, if you look up Midland Surgical Associates, it's there. The best way to come in to see us is to call our office, which is 432-697-1061, and you should be able to get an appointment with any one of us. When you do come to our office, patients will have great care. My nursing staff does a very good job, as well as everyone that you meet in the office. They understand that surgery is not something that's easy and that it's difficult, and it can be a life-changing process for you. So they all are very compassionate about it, and my nursing staff is always available to answer questions. And they also do a very good job with wound care and helping patients kind of understand what's going on. And then you're always able to get care from one of them. If there's any questions, we try to answer it to the best of our ability.
Great.
I have several patients that need home health for whatever reason, whether it's wound care or just assistance. And I've had nothing but success with Hands of Compassion. I've had patients that have never had them concerned about their wounds, and they've actually said very good things as far as my patients themselves have told me that they're very satisfied with who they have helping them out.
We're happy to serve you, so thank you so much. Thank you. And thank you all for tuning in to HOC TV. You're watching the Doctor of the Month, Dr. Miss Sunaru. Thank you all for tuning in, and we'll see you soon.